So spinal health in how it regards to just holistic medicine is an essential part. And the reason I can say that is because I've seen it over the years taking care of people. And a lot of times people don't take care of their spine. If you think about it, a lot of people go to their primary care practitioner once a year to get a physical. But really, all of us who've done that, how much physical testing do they really do? Right? Not much at all. It's more of a chemical test. So then it begs the question is, who's responsible for taking care of their spinal health? And unfortunately, it seems like that's just kind of gone missing, over the past 100 years or so. And that's really a place where chiropractic comes in, because spinal health is very important for mobility. It's important for communication between the brain and the body and the connections to the spine and the nervous system, and also a whole host of other things that we're starting to find out in the research now that makes spinal health one of the things that if you're not looking at right now, you should look into for just your longevity and overall function. So there's a lot of different ways that a chiropractic adjustment actually affects the body in a positive way. And a lot of times people just don't realize this. It's more of an education, problem, if you will. And one of the things that you see with people when they have poor posture is that they're going to have poor spinal alignment, right? Because they go hand in hand, because you can have a joint that doesn't move well, let's say in the neck, but you can also have an entire neck that doesn't move well, or an entire upper back that doesn't move well. And one of the most common things that I see is people who have poor posture where their head's gone forward and their shoulders are rounded like this. One of the things that we know instantly about a patient like that, or a person like that, is that they don't get enough oxygen in their lungs. And this is something that I've been doing recently with some of my patients that have breathing problems. And they're not, old patients, they're young patients that have a lot of upper back rounding. And when we adjust their ribs and we adjust their shoulders and their upper back, we're able to open up their lungs and allow them to use the appropriate muscles to breathe with. And we've seen their SpO2, which is a measure of oxygenation of their blood, go up after a spinal adjustment. I recently had a girl who was struggling with reactive airway disease that we were adjusting her spine, her ribs, and improved her SpO2 by 5 points. So she came in at 95, left at 100. And so that's one of the examples of where posture can be causing you serious problems with your health. And you may not feel it, but you can kind of see it if you know what to look for. So from a holistic standpoint, taking, the whole person, into the picture and how every little piece is connected, chiropractic plays a huge role in that, because when you adjust a spinal joint, you're actually improving communication from the brain to the body. And if you think about it, your brain, your nervous system controls everything in your body. And so if you have poor communication, one of the causes of this poor communication can be spinal misalignment. It can also be a pinched nerve, or it could be radiculopathy, when you actually have a nerve that's, actually has physical pressure on it from a disc or a disc-like substance. And when that happens, it can cause decrease in function to the nerves that are supplying specific organs. And that's something that we see from time to time in the clinic, even when people sometimes don't come in for these issues. One example would be a patient that was in a car accident. And they got in a car accident and they injured a disc or herniated a disc in their lower back. And not only did they have, back pain and pain going down the leg, but they also had constipation and digestive issues. And we started working on them, and the constipation, the digestive issues goes away, because when we get that spinal joint moving the way it's supposed to, and those muscles aren't tight in that area, all those receptors that go into the brain and back and forth and communicate, now they work the way that they are supposed to. Okay, so in calibration chiropractic and functional health, we primarily focus on treating really bad conditions that don't typically respond to traditional chiropractic, physical therapy, and other traditional medical approaches. And that's really just something I fell into out of a love. I found clinical neurology, also known as functional neurology, along the way and got a degree in that. And so we focus primarily on treating people with migraines, because migraines are debilitating conditions, and traditional medicine has very few good options for a lot of these patients. And then we also do a lot of work with people who have concussions. And concussions are one of these things that are like an invisible disease, if you will, because people get concussions and then a lot of them don't heal, and when they don't heal and they go in for testing, they get an MRI of their brain, they maybe get blood work and everything looks normal, but they're still wondering why they have headaches, why they are dizzy, why they have brain fog, why their short-term memory is affected, and a host of other symptoms as well. And so we focus a lot on migraines, concussions, and then another one that's a love of mine that kind of goes with the other two is dizziness, because migraines, concussions, and dizziness are all very similar types of conditions and have very similar types of, what would be the word, symptoms. And so we're able to work with these patients and reduce head pain, reduce dizziness, reduce brain fog, and we're able to do it naturally, which is really exciting for me to be able to heal somebody just by thinking about how to help them, putting a plan together, and then using technologies and adjustments and rehab that's all very safe to do. So, one of the questions I get a lot about chiropractic care is some people have heard, once you see a chiropractor, you got to keep going. And there is some truth in that. And the truth is if we think about that, nobody's taking care of their structure, nobody's taking care of their spine. By the time you wind up in a chiropractor's office, if it's been many years, since you've ever been seen, you probably have a lot of problems in your spine that you didn't know about. And you probably don't feel really good either. And so it is important to not only get that problem fixed, but then continue for maintenance to keep the spine healthy at the level that it currently is, and so it doesn't degrade more. And we know that scar tissue adhesions form in the body in about 21 days. And so if we can break up those adhesions, those scar tissues, about twice a month, then we can prevent that future spinal decay, pain, and problems, and also help people live a life that's much more full of potential than they ever would have thought if they didn't have chiropractic care. So, it is something that you do need to consider, for long-term maintenance, just like anything else. I mean, you've got to brush your teeth, twice a day. You've got to, go to the gym if you want to maintain your body, the physicality. You need to eat healthy if you want to maintain a proper weight and metabolic system. It's just like everything else. And it really just comes down to the person and how willing they are to take really good care of themselves. All right, so I want to talk about a couple of the misconceptions in chiropractic care. And I'm going to do my best to talk, broadly. And, you have to realize that, I practice the way I practice in my office. And every chiropractor actually does practice quite differently. So that's kind of the first thing that you need to consider when you go into an office, because we don't all practice with the same philosophy, and we don't all practice with the same technology or really education, because a lot of us have focused in or specialized in certain areas, and it makes us a little bit more suited to take care of certain conditions. So with that being said, know which chiropractor you're going to see, know what they're about, and try to figure out what you need, before you make that first appointment. Now, one of the biggest things that I've heard over the years is that, chiropractors aren't real doctors. And let me just shed some light on that. This is actually a story that started out in the 80s, and that was because the American Medical Association actually ran a slander campaign, a very well-organized and well-funded slander campaign against chiropractors nationally. And we actually took them to court and actually won that case. But it doesn't really matter because the damage was done, because people already have this perspective they're not real doctors. Well, I can assure you that we've taken many courses that are quite similar to a medical professional. Really, the big difference is that we're not taught drugs, right? So we're not taught how to medicate people. And I wouldn't want to learn that, actually, because it is a huge liability, because many people, a day die from properly prescribed medications. And it would also take away my ability to think and try to solve people's problems naturally. But we have a very good education, and we can, diagnose and get you to the right person if it's something that's not within our scope. And so that's the big one. We are medical professionals. We're able to sign on the same chart notes and the same documentation as medical doctors do. So that kind of confirms it. And then the other thing that I hear a lot about is that, chiropractors don't necessarily get anybody better. And that one is really determined by the doctor that you see. Because some chiropractors come from a wellness standpoint, and what they want to do is they want to make your spine as well as it possibly can be, so that you can, live life to the fullest. And some patients aren't looking for that when they walk into an office. And there's this mismatch because a chiropractor wants to make your spine healthy and all you want is your neck pain gone. And so sometimes what you need to do is find the chiropractor that's actually going to treat your pain complaint and get you better. And then maintenance could be something that you could do to make the spine healthier over time. And that's actually how we practice in our office, because I can tell you, getting a diagnosis for what causes your neck pain and treating you just for spinal health care are two different things. And so you have to know which one the patient wants, and you have to be willing to give that patient what they want if you have the skill set to do so. So that's just something to consider when you're looking for a chiropractor. And then the third one would be that it can be scary to get adjusted. And I can tell you that I used to, have a apprehension about getting adjusted before, I became a chiropractor. I went to the chiropractor for a lot of neck and upper back issues. And it did kind of, freak me out a little bit in the beginning, but I got used to it. Well, I can tell you that chiropractic care is incredibly safe. And the reason I can say that is because my malpractice insurance is lower than all other medical providers, which means that it's safe. The other thing about chiropractic care and safety is that we don't have to adjust everybody the way that you're thinking. So we don't have to take your neck and pop or crack it. We can do it with an instrument, we can do it with drops, we can do it with just light mobilization, massage type work. And those are some of the skills that we have in our office because we realize that certain people don't want to have their neck cracked. And so that's another thing you need to consider when you go to a chiropractor is, can they offer you additional treatments that will make you comfortable? Because if you're not comfortable throughout the process, it's pretty hard to heal from an issue. So another misconception, you will, in the chiropractic field is that we don't really play well with other chiropractors or other medical professionals. And I can tell you that for me, that's not the case at all, actually. We see a lot of people who have advanced neurological conditions, people who have been in very bad car accidents, and so we have to co-coordinate care because we don't want to miss anything and we need to manage all the pieces of the puzzle. And so one of the biggest things that we do in our office once we see somebody and we come to a diagnosis is that we check off any other provider referrals they may need to rule in or rule out other things that are related to that condition. And sometimes it has nothing to do with that condition. Like let's say somebody comes in and they've got headaches because they were in a car accident, but also they have uncontrolled blood pressure and they don't have a primary care. Well, we'll refer them to a primary care. There's been many times over the years where I've personally called people's primary care physicians, surgeons, and other people on their healthcare team and talked about different ways that we could treat them and different ways that maybe they could treat them so that we could all work together to get them better. And one of the biggest things that I've absolutely loved about being a chiropractor is learning from my other colleagues in the health and wellness field about how to treat things differently, because there's a lot of good information out there from spine surgeons and physical therapists, other chiropractors, PCPs, on ways that we can treat people better than I would have been able to understand on just my own and my own education. So one of the things I think is on the horizon, and we see this right now in Texas, is an interdisciplinary clinic. And what that means is that you would have chiropractors and other staff members that have professional degrees in the various healthcare fields all working under one roof on one patient to try to get them better. And so we do see a small amount of this right now, where you have medical doctors on staff, chiropractors on staff, physical therapists on staff, and so they can all come together to treat a severe spinal condition, because a lot of times when people are herniated disc, they need a lot of different things. They may need pain management, so that's got to come from an MD or a nurse practitioner. They may need injections, that's going to come from pain management doctor. They may need physical therapy to help stabilize the spine that's been damaged, and then chiropractic care and all the resources we have. And so we're starting to see that now kind of develop, where you'll have all these people working together. And I actually got my original education right out of school in one of these clinics, but it was very specialized. It was for people who had concussion, TBI, and a lot of other neurologic conditions that didn't respond to traditional types of care. And so we worked with medical neurologists, MDs, nurse practitioners, PTs, OTs, chiropractors, all working to help these people get better. And I think that this really is the future, because the more perspectives that you can look at a health concern or a health complaint with, the better data you're going to get and the better outcomes you're going to get for the patient. I've seen it time and time again at the facility I used to run, and I try to emulate it here with the knowledge that we have and all the specialty trainings we have, and then our entire network of providers in the area that we refer patients to. And I think what we'll see eventually is that we're going to have these big facilities that have all sorts of people in them, maybe nutritionists, maybe, counselors, chiropractors, all working to get somebody's body, as fine-tuned as what we possibly can with a minimal amount of invasive procedures possible. So if you or somebody you know has a serious spinal health problem or a neurologic condition and you've tried to get help from other places, we may be the option for you. And we take a holistic approach, as I was discussing, taking in all the different factors that affect your health, treating you as a person, not as a number, because we understand what it's like to be in pain. I actually had chronic pain for 6 years. I know what it's like to be out there, no one able to help you. And I know that you need a caring team of people who really want you to get better if you're going to succeed. And that doesn't mean that we can do everything for you, but it means that we will do our best to absolutely get you better and refer you to anybody else that may be needed on your healthcare journey.